In today's video, I'm going to be talking about visual fields and how we improve them for patients who have had a stroke and have homonymous hemianopsia. Before I go into that, let's talk about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, that's okay. You can still connect with us and talk to us about how we might be able to help you. Please go to our website at visionforlifeworks.com. You can do several things. You can read a lot of information there. You can take a quiz, but you can also click a button and schedule a consultation. All right, now let's talk about these visual field cases. I have several in front of me, and I thought it would be best because pictures really speak 1,000 words, or is that the right saying? Pictures are more important than 1,000 words. I don't know. But I think it really will help you to understand that these cases have seen visual field improvement since going through our program. So let's take this first case that I have, and I'll show you a picture of a visual field. This is something that would be typically seen, and there are several different components about a visual field that I'm looking at. The first thing is this was right after the person had a stroke, and why it's called a homonymous hemianopsia is this one whole side over here. If we look at the other eye, this one whole side over here happens to be lost because of the stroke. The reason why I say it's lost is that all of this black, if you look at this little chart next to it, corresponds to these numbers 0, which means that there's not a level of sensitivity even to the brightest target that they tried to show the person. They weren't able to see it. Now, this occurs again because of a stroke, and the area in the brain with which the stroke has affected somewhere in the visual pathway, and typically it's going to be maybe in the occipital lobe region that you see this type of a pattern exist for vision loss. Now, what I look at is this part, but also this part. I look at the corresponding numbers. The first thing, though, that gets me about this visual field right after this individual had a stroke is there's like this little bite-sized chunk right here, if you can see that. And it says that, to me, it screams actually, hey, this visual field can return, especially if I see this patient within 6 months after they've had their stroke. Now, if it's farther down the line, it's still possible to return some of that vision, but it gets a little bit more challenging the farther out it goes. So if I'm talking 2 years post-stroke, 5 years, 10 years post-stroke, that's a lot more challenging. We won't see as much change happen as rapidly. But if I get a person 6 months within that time frame of right after their stroke, then we're going to see some significant progress. So again, here's one eye. Here is the opposite eye right after the stroke. Now, let's show you what happens just a couple months into their therapy program, and you'll be able to see some progress for sure. So let's match up and make sure that we're showing you the right eye in the right eye and the left eye in the left eye. Okay, here is our original visual field with this little bite-sized chunk. And here we are a couple months into vision therapy. If you can notice, that bite-sized chunk has gotten larger. That means more of this individual's vision has returned. And if we go over here to the corresponding number chart with that, we can definitely see, instead of just 0, 0, 0, we're seeing some more numbers show up here. And then there is an area up here that definitely says 0 still. But you'll also notice there's like this little gray zone or region, and that area has some numbers associated. Those numbers, in fact, in this particular patient's case, are really good because those numbers are like 25, 24, 25, 26. Normal numbers of like sensitivity are typically going to range somewhere around about 27 to maybe 34, 32, somewhere in that range. This test may be a little bit different, but if we look on here, some of these numbers for this patient are going up as high as about 30. That's about as high as it goes. For this patient, then, that means that their level of sensitivity at 25, when 30 is kind of normal, we're getting close to that normal range for him of completely normal vision. Now, I will tell you, we did go on to see, and I don't think I have a copy of it, but we did go on to see that this individual got back all of this lower visual field, and we started to break into his upper visual field quadrant as well. So let's move on and let's look at another comparison. That one hopefully is an easy one for you to be able to see some changes on. Now, this is another patient that we worked with, and you can actually see quite a bit of progression on this one, which is really, really interesting. But this is right after they had their stroke. Again, what I look at, here's that homonymous hemianopsia because it's all down one side. But as we look at this, this is a progression of how it started to improve. So we first had this one after stroke, after a few months of working with them. This is what that looked like. And then now let's show you that larger bite-sized chunk being taken out. And let's compare it from the top original right after the stroke to a couple of months into working with us. You can definitely see how that area has gotten larger, which means that more of that patient's vision has returned. Now, if we flip this over, let's take a peek at the other eye. We've got a similar occurrence with this visual field, so it looks kind of the same from the right to the left, but here's that homonymous hemianopsia. Here is a little bit into the program. And then if we are making that comparison, let's just go from the very first one after stroke to a couple of months in. You can definitely see that much of that visual field down here is returning, and we're left with a little bit here and a little bit here. So a large portion of that came back. Again, this patient, although I don't have them to show you right now, I don't know why I don't have them, but they went on to have that fully restored, and a large portion of that top area of their visual field also returned. Now, let's look and see, because I have one more case just to show you. This one is so interesting. This is a patient that we are working with presently. And just to kind of let you know what is happening with them, this is their original visual field for each eye post-stroke. So this top picture here is the right, this bottom picture is the left. Now, the only thing tricky about this top picture is if we zoom in, camera person, please help me out. If we zoom in, this little area here looks a little pixelated. It just happens to be like the reflection off of the screen that was taken. But this is a full homonymous hemianopsia, a full defect over here. This one, again, pretty full, except for this little bite-sized chunk. Now, what's super interesting is the way in which the brain is bringing this vision back, just within a short amount of time. So this was, let's look at the dates. This was right after the stroke in June of last year. And then they started working with us just a couple of months ago. So they're only about 3.5 months into their program. And the first visual field test that they've had since they started working with us, I'm about to show you what that looks like. But what's so amazing about the visual field is that a similar pattern is returning for both eyes, which is highly unusual. But nonetheless, it's super exciting. So let's take a peek. So let's compare right eye. Unfortunately, what I have to do is I have to flip it because it happens to be on the back side. But here's the right eye, total black, all lost vision. And if I flipped over here to this one, you can definitely see this white bite-sized chunk taken out of there. That's an area of vision that's returning. And on the scale over here, when we look at it, those numbers are really high. They're 28. And remember before what I said was kind of in that normalized range. It's going to be like 28 usually to maybe about 33, maybe 34. So that is completely normal vision that has all of a sudden out of nowhere just popped up and is completely normal again. So what will tend to happen is the next visual field should make that go larger and bigger. It should expand. It may expand this way. It may expand up. It might expand down. More likely, what it will do is expand down and out this direction. Now that's the right eye. Let's take a look at the left eye. Because the left eye, you can definitely see homonymous hemianopsia, but remember there's a little bite of normal-ish type of vision up there. Now if we switch to the other side, let's take a peek. We still have that little bite of like normalized vision up here, but now look at this. Same pattern as the right eye. There's like this little finger bite-sized chunk taken out that's completely normal. If we look at the numbers over here, they're like 26 and 30. Super good level of sensitivity and normalized vision. So these are just 3 cases out of hundreds of cases that we've worked with for patients who have had a stroke and had a resulting homonymous hemianopsia that we've been working on and had really amazing success with them. Obviously, these patients were in different stages whenever I showed you kind of what their results were. And we get our patients to have a retest about every 3 months so that we can continue to monitor their progress. Now, maybe you've had a stroke, or maybe a loved one who's doing research for you has had a stroke. And you're looking at, are there possible things that we can do to treat this and make that vision return? The thing that's the most frustrating for me as a doctor, but also the most aggravating for patients and just heart-wrenching, is that most doctors don't know that vision can be improved. The thing that they tell you to do is to sit and wait and see what happens. Oh, hey, 6 months. If your vision's going to get better, it would just come back in 6 months. But what do they do if a person has a motor deficit and maybe they've they got like a weakness on one side? They go to PT. What do they do if they have memory problems? They go to PT. What happens if they have problems ambulating and moving around in their home? They go to OT. What happens if they have, say, problems with their speech? They go to speech therapy. Why in the world then do doctors not recommend that patients go to vision therapy to try to recuperate their vision? Well, for number one, I think honestly, we've done a really poor job in realizing as doctors who do this sort of stuff that you can actually improve vision. And I think many doctors are afraid to even deal with it. But that's where I might be different. I had some patients who approached me a couple of years ago, and even though I'd been dabbling in returning vision, I hadn't really been doing it a whole lot, even though I've been a doctor for 23 years. But as those patients were approaching me and saying like, hey, do you think we can maybe work on returning my vision? Why not? Let's give it a shot and see what happens, because we've had success with this thing, with this thing, with this thing. And so we gave it a try and we started to notice some significant results. Now, the difference between what other doctors may be trying to do to help with vision and what we're doing is that I have a specific program that I've been successful, that I designed myself, not that someone else taught me, not that I gathered from my schooling all those years ago, 24 years ago. Oh my gosh, that's so crazy to think about. But really because I developed it based on what I was seeing with patterns with my patients. Hundreds and hundreds and thousands of patients that I was working with, I saw some patterns. And I started to realize there were some specific filters with Centonics and then specific hands-on vision therapy that we could be applying to these cases to help them be able to restore some of their vision. In some cases, it was 10%. In some cases, it was 80%. In other cases, it was 100% of their vision came back. And then I got vocal and I started talking about it. So the sad thing for me is that many doctors don't discuss this. Again, they'll recommend OT, PT, speech, memory therapy, but they tell someone to sit on the sidelines and just wait and just see what happens with your vision. For me, that's really not good enough. So your call to action is if this is you or if it's a loved one and you're, ferociously looking for an answer, you may have just found it. I want you to contact us. That's your call of, call to action. Contact us if you're local, 618-288-1489. But if you're not local, that's okay. You can go to our website at visionforlifeworks.com and schedule a consultation directly from there. You may be one of our next success stories in improving your vision. And some of these cases, again, are fairly new to us. They've only been in therapy for just a couple of months. And others are cases that we had a year ago or 2 years ago. And we have hundreds of these cases now. So, again, you might be one of them. If you haven't done this already, make sure you hit the like button, subscribe to our channel, and definitely, if this isn't you, but maybe it's your uncle, your friend, or another loved one outside of your immediate family, pass it on, because you may be giving them the gift of improvement with your vision and gaining their vision back. Thank you.